It is officially HIV Awareness Month. Hear how a local woman is doing just that, saving millions from the disease. And there's a health connection that you should know to help keep you healthy and strong. Let's dig into it. December is recognized as HIV/AIDS Awareness Month. It's a time to spread awareness of a growing epidemic in the United States. I want you to take a look at this map because this shows the rates of people living with HIV/AIDS in the U.S. The CDC says there are 1.2 million people who have HIV. Looking closely at North Carolina, there are high rates for HIV in our state, specifically in Guilford County. On average, 3 people a day in our state contracts HIV, and that is according to data from the CDC. Our team spoke with a doctor who explains what the epidemic looks like in our state.
My typical new patient, I would say, is usually 18 to 25, typically an African-American male.
The reason, she says, is largely due to a lack of education. With COVID being the spotlight the past few years, she says many of her patients come in unaware they have HIV. Some don't even know what the virus is.
That's probably one of the more common things that people tell me, like, oh, I didn't know that was still there.
While the talk of HIV hasn't been in the forefront, the treatments for it has been advancing behind the scenes. Dixon says now treatments are keeping people undetectable and living longer. Plus, there is now medicine to prevent people from getting the virus. PrEP is a pill you can take once a day, which has a 99% effectiveness rate when taken as prescribed.
It's pre-exposure prophylaxis, so it's medications taken as prescribed, whether that's pills daily or injections every 2 months or so. That will help also reduce the risk significantly for people acquiring HIV.
And testing now can tell if your medicines are doing their job. In addition to monitoring your HIV status, lab tests can also make sure the medicine isn't having any side effects on your body.
Well, the advancement of HIV medicines hasn't just helped people living with the disease, but also their partners who want to protect themselves from contracting the disease. This next story is about a woman who is helping other women protect themselves.
After starting a relationship with a partner living with HIV, Britt Williams wanted to keep herself safe.
One of my go-to phrases is don't let HIV get in the way of love.
She thought the HIV prevention medication, PrEP, or pre-exposure prophylaxis, was not for women. She learned she could be taking it.
I continue to use PrEP because it's one less thing I have to worry about as someone who's actively dating.
Williams now wants other Black women to know they too can protect themselves. PrEP is 99% effective at preventing HIV.
There's been some substantial progress that we need to continue in young and gay bisexual males, but we haven't seen anywhere near that progress for Black women.
Dr. Robin Neblett fanfares with the CDC. Its She's Well campaign aims to improve awareness.
So much of what we see when we think about disparities are really because of long-standing systemic inequities, and those can really impede access to HIV testing, prevention.
National HIV consultant Leisha McKinley Beach says many Black women don't know prevention is an option.
The commercials make it appear as if it's only for men. If we are serious about ending the HIV epidemic, then there's got to be equity in resources.
Williams was finishing her PhD when she had trouble getting her PrEP prescription. As an education professor, she now focuses her research on Black college women and HIV/AIDS.
This ended up becoming part of my life's work, and it's a way of helping Black women understand that you can have healthy partnerships.
She says knowing how to protect yourself is key. Danya Backus, CBS News, Los Angeles.
The CDC says there are different PrEP medications approved for use, but Truvada or its generic version, the shots, are the only medications that are approved for use by women. The CDC says people living with HIV are more likely to get tuberculosis than others, which could lead to a shorter lifespan. When a person has HIV, the disease attacks and destroys their CD4 cells. These are supposed to help your immune system fight off infection. So when they are destroyed, it makes you more susceptible to getting sick with other illnesses, one including TB. The reason why we talk about this is because TB has recently been in the news right here in the Triad. We're going to get an update for you coming up at 6 o'clock.